While the components of the healthcare ecosystem are the same in every country, patients' actual experience of accessing healthcare can differ greatly. This is largely driven by who the payers are and how they function. Payment from insurers or out-of-pocket spending are private sources, while payment from the government is a public source. The split of private spending versus public spending varies widely across countries. For example, Norway's government pays for 85% of healthcare expenditures, while Switzerland is closer to 30%. First, let's talk about public spending. There are two common systems that countries use to administer public spending. The first is a national health system, with the government acting as both payer and provider. In this kind of system, the government itself funds and operates a national network of public hospitals that all citizens can access, mostly free of charge. England's National Health Service, or NHS, is an example of this model at a national scale, whereas the United States' Veterans Health Administration is an example serving a specific subset of the population, in this case, military veterans. Another common system is national health insurance, where the government covers the bulk of healthcare spending through a public insurance program. Most providers are private, as opposed to government-operated, but receive payment for services through the government insurance. Canadian Medicare is a form of national health insurance offered to all citizens, while the United States' Medicare and Medicaid are national health insurance programs covering only seniors and low-income individuals. Countries like the UK and Canada are known as single-payer models, as the vast majority of healthcare spending comes from the government. This allows the government to exert significant control over the prices paid to providers and pharmaceutical companies, either directly or through negotiating power. Now let's talk about private spending. It can come in two main forms. Private health insurers pay providers through claims against insurance policies, which can either be employer-funded plans or purchased directly by individuals. In some countries, individuals are mandated to purchase health insurance in order to increase healthcare coverage. The U.S. is the world's largest private health insurance market, with nearly 40% of all healthcare spending paid by private insurers. Any costs not covered by the government or private insurance result in direct out-of-pocket payments from patients to providers. This is often a good indicator of the healthcare burden patients face, as out-of-pocket payments are typically less predictable than insurance premiums or taxes. Even in countries with similar levels of private healthcare spending, out-of-pocket spending can vary significantly. In Mexico, out-of-pocket is nearly 40% of total spending, while in the U.S. it is only 10%. Overall, all countries rely on a mix of both public and private payment sources, and frequently have multiple payment structures. While the healthcare system is complex and varies significantly by country, the general objectives remain the same. All are trying to make healthcare accessible to as many people as possible while ensuring it is high quality, all at the lowest possible cost.